Good afternoon. Thank you for joining us today. First off, I'd like to acknowledge that today is Bell Let's Talk Day in support of mental health across Canada. Mental health is such an immediate and important topic, given even more weight because of this pandemic. The latest wave has, in many ways, been the cruelest yet. The timing, the reach. So today, it's important to recognize that it's okay to not be okay. It's okay to talk about it. In fact, it's therapeutic. We must collectively dispel any stigma out there around mental health to make it a vital part of our own health, growth, and conversation. I personally find exercise important for maintaining my own mental health. And during my run this morning, I thought about everything that we have to appreciate here in Newfoundland and Labrador. Leading the country in vaccinations, navigating the pandemic very well, all things considered. Beautiful scenery, safety, family and friends nearby, and kind, generous people. So I encourage you all to show your support, whether that's by engaging with Bell Let's Talk online or using today as an affirmation or reminder to reach out, speak out, or check in. Join the chorus of voices supporting mental health here in our province and across our country. I'd also like to take a moment to tell everyone who has COVID-19 or recovered from it that we are all collectively thinking of you. And we send our condolences to all of those who have lost a loved one to this terrible virus. My friends, today is the second day of having our kids back in the classroom learning. In our house, it was a great week. Our kids are happy to be back. The attendance rate for students across the province was more than 80% yesterday and again today. Attendance rates for staff are pretty much normal. So this is encouraging news indeed. I spoke with several parents yesterday and heard a range of opinions. Some in support, some are still very worried. Believe me, we all feel it. When you have kids, that kind of concern never leaves you, no matter what. And our son has asthma, which many of you know is of greater concern. But we know the facts, as Dr. Fitzgerald laid out so well last week. The risk for kids' mental health and education moving forward is greater than the risk of the virus itself. And that weighs heavily on all of us. We must trust the science, the evidence. We must concentrate on the positives. Right now, almost 80% of our children between the ages of 5 and 11 have their first jab. Over 93% of teenagers are fully vaccinated, and over 70% of teachers are boosted as well. In true Newfoundland and Labrador spirit, we are leading the nation. We must keep that up. I know you are tired of hearing the mantra that vaccines work, and boosters continue to be our best line of defense. But please, continue to listen. If not, we won't get through this. And just consider this one fact from the Centre of Disease Control. Unvaccinated seniors with COVID-19 were nearly 50 times more likely to be in hospital than seniors with 3 jabs. That is an overwhelming fact, which is why we are evaluating making a change to the Newfoundland and Labrador Vax Pass to reflect booster doses in the coming weeks. Right now, there are a lot of amateur epidemiologists out there spreading disinformation or opinion disguised as fact. But for the last 2 years, we have listened to and trusted the guidance of Dr. Fitzgerald and her team of true epidemiologists. I implore you to keep doing that for our kids, for all of us. With that, I'll turn things over to Dr. Fitzgerald for today's update.
Thank you, Premier. Thank you all for joining us today. We now have 20 people hospitalized due to COVID-19 severity, and there have been 308 recoveries, leaving us with 2,680 active cases in the province. Since the update yesterday, we are reporting 304 new confirmed cases of COVID-19. 240 are in Eastern Health, 36 in Central Health, 23 in Western Health, and 5 in Labrador-Grenfell Health. 2,017 tests were completed since yesterday, with over 474,000 tests completed to date. Unfortunately, we are also reporting 3 deaths today due to COVID-19, all in Central Health. I offer my condolences to the loved ones of those individuals. This brings our total of deaths to 34. Yesterday, students across the province returned to in-person learning. I know that this has been an anxious time for many parents, students, and staff. Returning to school is one of our biggest adjustments in learning to live with COVID-19. I also know that there is still a great deal of discomfort around that concept, and I completely understand and empathize with that. After 2 years of asking you to do everything in your power to avoid COVID, it is very difficult to accept COVID as part of our ongoing reality. It has even taken me time to come to terms with this. I know that the concerns and lessons that have been our reality over the past 2 years cannot be undone overnight. This will take some time. And while we acknowledge that this is a difficult adjustment, public health must make decisions based on evidence. And the evidence shows that the benefits of school for children's development, health and well-being far outweigh the risks of illness in this population. This is supported by the advice of pediatric experts across Canada, and it is in line with the approach being taken in other Canadian jurisdictions. The vast majority of people will have mild illness with Omicron, and particularly so for children. This variant does not behave like the original strain or Delta, which caused severe illness. In terms of spread and symptom severity, Omicron behaves similarly to other respiratory viruses, such as influenza or RSV, which we see every year in children. Furthermore, unlike the outbreaks of 2020 and early 2021, we have a highly vaccinated population. Over 93% of those 12 and older are fully vaccinated, and over 77% of children aged 5 to 11 have at least 1 dose, and a very recent dose at that. This will provide some defense for the 8 weeks until they can get their second dose. That overall level of population protection is what's helping to keep symptoms mild and our hospitalization rate low. Taking all that into consideration, during the last 2 years, we did exactly what we needed to do. We protected ourselves and our loved ones against several more severe COVID variants, and we had the time to be vaccinated. All that work we put in has prepared us to now see this through. So given this variant is causing milder disease, and we are asking people to learn to live with COVID, we're often asked, why is it that we're still in alert for and impressing the importance of restrictions? This is the delicate and constant balance that public health has been working to achieve since the start of the pandemic. Our goals are to minimize the impacts on society while also minimizing severe disease and death and keeping hospitalizations at a level that our health system can manage. Our vaccination rate is helping to keep hospitalizations down, but we still have work to do. If you have a child in school or you work in a school, there are layers of precautions in place in schools to help reduce the risk of COVID transmission. Masks remain one of our most important tools, and while the precautions do not eliminate risk entirely, the risk is still much lower in a school than in other indoor activities outside the school setting where masks are not worn. So please do not assume because schools are open that it is time to return to normal activity everywhere. We are still in alert level 4. We are still recommending that employers permit staff to work from home where possible, and the maximum for a formal gathering of people in one room is still 25% of room capacity or 50 people, whichever is less, and informal gatherings are still limited to those in your tight 10. Now is not really the time to be expanding your bubble. We are reporting about 300 new lab confirmed cases per day, and this will increase in the coming weeks as a direct or indirect result of school exposures. Schools are essential, so we have to accept that increase so that children can get back to where they need to be. To balance that essential increase that we will see, we need to avoid a similar increase from non-essential activities. When cases rise, a rise in hospitalizations follow. individual. We need everyone to stay the course while we navigate this critical transition period. For businesses and organizations that have resumed group activities such as sports, fitness, and dance classes, please ensure that your coaches and instructors are aware of the special measures order that requires participants to physically distance at all times, meaning from the time the participants walk in the door until they leave. We are getting reports of situations where distancing is not being maintained, and this is important, especially during physical activity and without masks. When we receive information such as this, we engage with environmental health officers, with digital government and ServiceNL, who can reach out to the businesses or organization to ensure they understand the requirements. I also want to address some changes that we have made around contact management. With about 13,000 lab-confirmed cases of COVID-19 in the last month, and likely thousands more cases that have not been lab-confirmed, many people will find themselves exposed to COVID shortly after recovery. Anyone who had a COVID infection that began on or after December 21st and subsequently becomes a close contact in the following 90 days, they are not required to isolate or be tested. As Omicron is still a relatively new variant, there is limited evidence on reinfection. However, given what we know about the immune system response to viruses, it is expected that protection will last at least 90 days. This applies to individuals of all ages and vaccination status. We will update this guidance as more information becomes available. We are also getting many questions around notifications of exposures in schools. Parents are not obligated to notify the school if their child has a COVID-19 infection, and I know that some parents have concern with this decision, and I completely understand that you want to know if your child has been exposed to COVID. With this guidance, however, we are trying to prevent asymptomatic students from being caught in repeated cycles of isolation. That would take a toll on the mental health of the individual, the well-being of the family, and school and society's ability to function. Again, this is all part of that careful balance of benefits and harms. And I'd like to thank parents and staff, school staff, for their understanding and patience moving through this transition period. If your child develops symptoms, use your rapid test kits as instructed that were sent home. If both tests are negative, your child should stay home until their symptoms are improving and there is no fever for 24 hours. If you are out of rapid test, please contact your school administration to refill your supply. If your child develops symptoms after receiving their vaccine, that is likely an after effect of the immunization, and you should not use a rapid test in this case. They should stay home and only use a rapid test if symptoms persist or worsen. I'd like to take this opportunity to encourage everyone who is eligible to get your COVID-19 vaccine booster dose. Emerging evidence now shows that the risk of hospitalization are greatest for those over 50, and this increases with increasing age. It also shows that booster doses offer more protection than 2 doses. So as previously mentioned by the Premier, those over 50 years of age, you're up to 49 times more likely to be admitted to hospital if you are unvaccinated compared to someone who is fully boosted. If you have 2 doses of vaccine, your risk of being admitted to hospital is still much lower than if you are unvaccinated, but you are still 17 times more likely to be admitted than someone who is fully boosted. About 70% of those over 70 have had a booster dose, which is very good uptake. We'd like to see that continue, of course. However, booster dose uptake in the 50 to 69 age group is much lower at only 40 to 50%. So we strongly encourage anyone who is eligible to get their booster dose, and especially those in the 50+ age category. Please make the choice to ensure that you have that maximum protection available. There is no doubt pandemic fatigue is stronger than ever, and each and every one of us are feeling it. This is Bell Let's Talk Day. Today and every day, we need to keep talking about mental health. We need to be compassionate and kind to one another, but we can often forget to be kind to ourselves. We don't have to stay strong all the time. Some days we just need to take stock of how we're feeling and do what we need to do to keep our cup from running empty. Bell Let's Talk Day is a great time to remind people that there are a number of mental health and addictions programs and services available throughout the province for people of all ages. You can visit the service directory at www.bridgethegap.ca to find the service that is right for you or your loved one. You can also call our Provincial Mental Health and Addiction Systems Navigator Monday to Friday, 8:30 a.m. to 4:30 p.m., toll-free at 1-877-999-7589. Take care of yourselves, be kind, and hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. I'll now invite comments from Minister Haggie. Dr. Haggie?
Diseases specialists in the province for pediatric and for adult infectious diseases are available and will continue to be available to provide their expertise in guiding who would benefit from these treatments. They are not for everybody. They are designed to reduce the risk of hospitalization in those who are at significant risk of hospitalization. So it would be the elderly, it would be the partially vaccinated, and it would be people who are immunocompromised. There are very clear clinical criteria. You have to have a positive COVID test, and it has to be within 5 days of the onset of symptoms. There are, however, significant challenges with these medications. They have severe and widespread drug interactions, for example. So this discussion is one that needs to take place in some detail. We are aware of one course of treatment that has been prescribed currently in Eastern Health, and we will continue to monitor that. As the supply of that drug increases and it stabilizes, then we're working on plans to make this available in a more traditional way through community pharmacies, for example. But that's for the future, the next few weeks, and not for today. I would just close by saying it's Bell Let's Talk Day. 5 cents from Bell is 5 cents more than we have at the moment, and get the shot. That is your best defense for yourself, for your family, and your loved ones, and for all of us. Thank you, Premier.
Well, thank you, Minister. We'll now welcome questions from the media. Of course, online today, we're joined by Minister Osborne, Tony Stack, and Kim Christensen.
Thank you, Premier. Today we have 7 reporters joining us. The first round of the question and answer session will give each reporter the opportunity to ask one question and one follow-up. There will then be a final round where each reporter will have the opportunity to ask one final question. Our first questions are from Richard Duggan with VOCM. Richard, please go ahead.
Thank you. My question is for Dr. Fitzgerald. As was referenced in your opening remarks, we've said that this Omicron variant of COVID-19 is often less serious than other strains, but over the last couple of weeks, we've seen far more deaths from Omicron than any other in this province, including the 3 that were unfortunately announced today. given that this strain is said to be less serious, why is it that we're seeing quite a higher death toll with Omicron?
Yeah, so when we're talking about that, we have to consider that we're looking at rates, right? So we have, and this is part of why we are saying we need to take things slow, is because when you have a large number of cases, so when you have a virus that's spreading quite easily and rapidly, and you have a large number of cases, then even if it's a milder virus, you are still going to end up with more people who are end up with severe disease, and some unfortunately who die. So it's not really because the disease is more fatal, it's because we're seeing more people with it. And that's why we have to take this slowly and ensure that, we don't open the tap too quickly and have a large number of people, many thousands of people sick all at the same time, so that we can maintain that capacity that we need to maintain. So it simply comes down to numbers, I guess, in the end.
And my second question is also for Dr. Fitzgerald. On last week's briefing, you made a comment about gatherings outside of school settings, such as kids' birthday parties, and how they're not recommended unless it can be kept to a kid's steady 10. I've seen a lot of criticism about this from parents who are questioning this while kids are allowed to go to school. Can you address those concerns and explain the rationale behind making that recommendation?
So what we're trying to do, as I said earlier, we're trying to, we know that we're going to increase case counts by allowing kids to go back to school. That's, we have more interactions when we're in school. There's no doubt about that. So we will see more cases. So in order to keep that level at a point where the system is able to withstand it, be able to handle the hospitalizations that come potentially, we have to reduce that risk in other places. So we have acceptable risk here at one level, and then we need to try to keep the overall risk low. So, we want to reduce the risk in other non-essential areas. That's why we don't want people to be having more contacts outside of school where masks won't be worn, and those sorts of things. If a child, if your child has a best friend who they always play with and are, that's a part of your, your steady 10, then obviously that's a different situation than bringing together a whole pot of people for a party where, they may potentially not be wearing masks and that sort of thing.
Our next questions are from Andrew Waterman with The Telegram. Please go ahead.
Good afternoon. This would be for Minister Osborne or perhaps Tony Stack. I'm wondering, since the decision to return to in-person classes was announced, how many kids have been accepted for remote learning, and what specific medical conditions would qualify a child for remote learning?
So I think Mr. Stack can add to this as well. But today we have announced that we are expanding what we're offering through CDLI, for example. And just to give the details, Tony can expand on it. Currently, we have over 40 courses that can be accessed by high school students. CDLI, Center for Distance Learning, has primarily been utilized by people in remote and rural communities. We are encouraging all students in the high school level to create an account with over 40 pre-taped instructional of curriculum. They can log in, pick up if they need to self-isolate or if they're off for illness or other reasons. They can log in, pick up where they've left off. It won't be their classroom teacher, but it's a qualified teacher who's pre-taped the instruction. There's multimedia there as well. We are expanding that for junior high school students in literacy and numeracy to allow for those students to also have access. There are some resources there for junior high now. There's tutoring available for both high school and junior high. The expanded courses for junior high should be available and online in February. Tony, did you want to add to that?
Thank you, Minister. So the Center for Distance Learning and Innovation has been part of the Newfoundland and Labrador education dynamic for some time. And over that time, we built quite a bit of learning content online asynchronously. What you're going to see if you go in is course review material. So there's review material to assist students in writing exams. There's also an online tutoring component, and this is manned or staffed by Memorial University of Newfoundland and Labrador students who have a particular subject matter expertise, and students can avail of that. In terms of learning resources, the minister clearly pointed out there is content there to support over 40 different courses in the high school area. There's some amount for junior high right now, mainly in the mathematics area, intermediate. These are lessons that are self-paced, multimedia learning objections, and they can be availed of by any student at any time in the province. And this has existed for some time. In normal pre-COVID times, it would be a supplement to what's happening in the classroom, or to assist a student who might be home for another medical reason, like a broken limb or whatever. In this period of time, it's for anybody who might have to self-isolate. Not really intended for long-term learning, but it is an excellent resource. With the addition of 6 additional teachers to start populating some content in the intermediate capacity, this will greatly enhance our ability to support students in their learning when they have to be at home. Obviously, the most ideal learning environment is face-to-face in the school setting. In terms of the original question pertaining to the number who related to immunocompromised, I'm not really, we have a medical definition, best alluded to by medical professionals, but if we had a process for application, and there are about 29 students who have been attending a school called Connect Ed, which we instituted last year, for all of their learning since September. So that is a very special criteria. If there's any new or emerging situations that we're not aware of, with respect to immunocompromised children, please contact your administrator and see what we can do to process applications.
And this would be a question for, I believe, Mr. Haggie. Is the Department of Health tracking cases of long COVID in the province? And if so, is there any information you could provide?
Thank you. The department is not, and we cannot provide you with any specifics around long COVID. We will certainly take that under advisement and speak to our infectious diseases experts to see how that could or should be done.
Our next questions are from Ben Cleary with NTV. Please go ahead.
Hi, thank you, and good afternoon. My first question is for Minister Osborne or for Mr. Stack. Yesterday, a school in Labrador had to suspend in-person classes in grades 8 and 9 because of staffing issues. What's your status on that school now, and are you worried it could happen in other schools across the province?
So in Menahek High School in Labrador, we had a challenge yesterday. There were a number of staff members who were unavailable for work. And this, we then used our cascading approach, our incremental approach to the protocol, which was we had our high school students in, the grade 8 and 9 students stayed home yesterday. Everybody is fully accessible and eligible to attend today. All grades are open. And it was, situation has improved. We are somewhat challenged in Labrador West, given the shortage of substitute teachers. We are able to leverage our process and even put in district personnel, and that situation has improved greatly. So they're full up and running today.
Thank you. And my next question is for Minister Haggie, and that's now that we do have the Pfizer antiviral drug in the province, what should people know about it, and will it make a difference in the community?
It's a good question. The information around the use of the drug is available to clinicians, and we'll certainly have a screening guideline tool available. Currently, the route for accessing the drug is to discuss that with the provincial infectious disease specialist on call, either for adults or for pediatrics. It is available for people aged 12 and over. There are some clear clinical criteria that you have to meet, and there are a significant number of major drug interactions that would prevent its widespread use. It is not a drug for everybody. It is a drug to reduce the risk of hospitalizations in those who are frail, who are elderly, or who are in demographic groups that we know are at high risk of hospitalization. So it's another tool. It will not be a panacea, and its use will be determined by physicians on the basis of clinical recommendations.
And if I could add, Minister, it's not a replacement for vaccination. Vaccination is still very important. This is, as Minister said, it is a tool in our toolbox, but vaccination and prevention is still, your best bet for reducing your risk from COVID.
Our next questions are from Peter Cowan with the CBC. Please go ahead, Peter.
Question for Dr. Fitzgerald about contact tracing in schools. I've heard from parents who are concerned, for example, that in a classroom, students, when they eat lunch, they all take their masks off. So, their masks aren't being worn at all times. And yet, if one or some of those children test positive, they're not considered close contacts and aren't going to be notified. Can you explain the rationale for that? And even if the decision is that it's best not to make them isolate, why not at least give parents the information about how many kids have tested positive in that class so they can make decisions on their own? For example, maybe they don't have the grandparents come over, things like that.
So certainly, we understand the concern there, but it's really about trying to reduce that amount of isolation that people will have to go through. And we know that with all of the extra things, with masks being worn most of the time in school, we know that the cohorting reduces the spread more widely in the school. And as well with our testing program, we know that children who are symptomatic will be able to test, and that reduces the risk of having someone who is infectious in the school environment. So that is our reasoning for making that recommendation. Obviously outside of the school environment, if children are playing together and hanging around together and not wearing their masks around each other for a more extended period of time, then obviously that's a different situation and a higher risk contact. And so that's why we certainly would recommend that people be notified in that situation. And, if parents want to notify close friends, then certainly, obviously, that's something that can be done.
We haven't had much talk about long-term care homes. I've heard from family members of people in long-term care who are concerned about especially the mental health of their loved ones, because many of them have seen no visitors now for more than a month. Where are we with resuming some visitation, and why is that continued to be locked down right now?
Minister?
Thank you. That is a good question, and it's certainly something we review with public health on a regular basis. It is an active topic, and I think we may be in a position to make changes to those visitation restrictions within the next 24 or 36 hours. The facts of the case is that age and increasing age and frailty are predictors of hospitalization, even in the vaccinated. And they are also a predictor of the risk of death. So again, right back at the beginning in 2020, we took an approach that was really very vigorous to protect those seniors. And whilst I accept the comments about loneliness and isolation, it is still less risky for them than being exposed to COVID. Now, with the advent of a rapid testing protocol, with the presence of significant uptake of boosters, the balance of risk shifts slightly, and as that shifts, we will adjust our visiting requirements. And as I say, I think we'll be in a position to make an announcement on that front within the next 36 hours.
Our next questions are from Renelle Legros with All Newfoundland Labrador. Please go ahead.
My question is for Minister Haggie. I'm wondering if you could provide an update on how things are going at the lab. Is there any backlogs or samples or anything of that nature, or are we able to keep up with the demand locally?
We can keep up with the demand locally. We're running anywhere from 1,800 to 25 or 2,600 PCR tests in the public health lab each 24-hour period, and that's well within our capacity. There are no tests that I have been informed of in the last week that have gone outside the province, or any results from outside the province that we're waiting for, other than maybe some genotyping reference studies from the National Microbiological Laboratory.
And my follow-up question is for the Premier or Dr. Fitzgerald. I'm wondering what the outlook is now for the alert level. Is this being reviewed on a weekly basis or bi-weekly?
We're certainly committed to evaluating it weekly, depending on the change of instruments that we've used along the way. So if you look at, one of the things we've learned over the course of this pandemic is doing too much too fast, as you've heard Dr. Fitzgerald say many times, is been to the detriment of different jurisdictions. So we want to make sure that we're going incrementally and evaluating those increments as we go. So we're committed to reevaluating the levels weekly, and as we change things, and we'll wait another week to see what impact it has made.
Our next questions are from Roger Bill with the Shoreline News. Please go ahead.
Thank you. A question for Dr. Haggie. It comes from Craig Westcott, the editor of Shoreline News. And Craig would like to ask, can you tell us what percentage of the people who have died, 34 people who died, were vaccinated, and what percentage were unvaccinated? I know 6 weeks ago you couldn't answer this question because of the numbers were so small and there are privacy issues, but I wonder if you're in a position now to speak generally about it.
In general terms, the last report from our modelling group showed that our last kind of group, if you like, of Omicron likely related deaths, there were about 60% who had had vaccination of one form or another.
A separate question: what does reported number of recoveries mean? Is there some contact tracing that happens that people are followed up who were positive, and then are you recovered, or is it just a presumption that after 10 days people have recovered? Can you explain what that number means?
Yeah, so it certainly it's changed as we've gone through the pandemic, and initially, obviously, all cases were being followed by public health until the Omicron wave, and now, as everybody knows, that's just not possible anymore. And so at the moment, what we look at is if you are 10 days post test date, and you are not seen as being hospitalized or having severe disease in some way, then you are considered recovered.
Our next questions are from Kyle Brookings with the CNA Journalism Program. Kyle, please go ahead.
Thank you. My question is to Minister Haggie. Long-term care employees are required to take rapid tests twice a week. Are we looking at something similar for acute care employees?
Private businesses have the ability to set their own workplace regulations or requirements in addition to obviously what the public health have mandated through special measures orders. We do have rapid test protocols for long-term care and for a variety of other facilities such as schools and those kind of things. They are not in widespread use across acute care facilities. That has not been the advice we've received from Infection Prevention and Control or Public Health.
Okay, and my next question, also for the Minister, why were all government employees not provided rapid tests?
We take our advice about the use of rapid tests from Public Health and Infection Prevention and Control. Given the fact that currently significant number of people are working from a home environment whenever and wherever possible, certainly the need for that just on an empirical basis would not be there. In terms of whether or not we would get to the point of providing rapid tests to government employees, that would rely on two things. One is it recommended by IPAC or Public Health? And the second thing is the supply sufficient for us to meet the demand in addition to those areas where we know it does have significant clinical and systems value? So for schools, for long-term care, for daycare, for points of entry. And currently our supply chain is challenged. We do now have definitive dates for delivery quanta from the federal government, but that will take us into mid-February. We have enough to meet the priority groups I've mentioned, as well as to keep them resupplied and to keep a small reserve in case of outbreak management where they would be used as before in particular small communities. So there are two challenges around the government employee piece.
Thank you.
I will now go back through each reporter to see if you have one final question. Richard Duggan of VOCM, do you have a final question?
Yes, I do. We've received a number of reports of an outbreak of COVID at the Boise's Bay mine. We contacted the company, and they didn't give an answer as to how many cases there are, instead saying that all cases are being reported to public health. So my question is for Dr. Fitzgerald. How do you report those cases? Are they included in the regional breakdown for Labrador-Grenfell? Are they the outside RHA numbers? How are they reported?
In general, we report cases where the person resides. So, if someone resides in Central but works somewhere else, that gets counted as a central case, and that's sort of how we do things. Just because you need a constant to be able to keep track of things. But the staff in Labrador-Grenfell Health are in. They consult with people at Boise's Bay on a regular basis, and their public health officials there are providing advice as needed when Boise's Bay are reaching out. I can't speak to cases in that as it's a private business, and I don't have that level of detail to be able to answer questions about cases there. But certainly the staff in Labrador-Grenfell Health are are available and certainly have consultation as needed with Boise Bay.
Andrew Waterman with the Telegram, do you have a final question?
Yes, I do. So this would be another question for either Mr. Stack or Minister Osborne. You mentioned in your news release and earlier that there was more resources being put in place for high school and junior high, but I see no mention of elementary school or kids in K-6, and I'm just wondering if there's anything available for immune-compromised kids, or is there any more resources available for kids in that age group?
So I can start, and Mr. Stack can add. Through CDLI, it is a self. The individual is responsible for logging in and following their own course line. It's more appropriate for high school. It is appropriate for junior high, but less appropriate for the K-6 grades because it's self-directed. So therefore, the CDLI, we are focused primarily on high school and then junior high. In terms of other resources, there is a continuance of learning, and Mr. Stack, you can probably add some more detail in that regard.
Thank you, Minister. Quite correct. There is a continuity of learning that would occur if a student has to stay at home due to illness or self-isolation requirements, which the school will do its best is not full up virtual learning. School will do its best to keep the student engaged and kept track with the pace of learning that's occurring in the classroom. The other resource that we have, and this applies as a supplement to anybody out there in the K-6 environment, which has been built up over time, there is a learning at home resource off our website. So if you go to our main page, you can access it under students and parents, and it is called a Learning at Home, and there's some rich resources in there around Google Suite and how to access that. You know, a lot of teachers, more so than ever before, are posting materials there. You know, children are working with colleagues in classroom on documents, presentations through that virtual means, asynchronously or synchronously. So there are some things that can be done, and I would encourage any parent then to check out our website for their K-6 child to augment learning that's happening now in the classroom or in situations where they have to stay home for medical reasons.
Ben Cleary with NTV, do you have a final question today?
I do, thank you. I have a question for Dr. Fitzgerald about isolation requirements. If someone is fully vaccinated and a close contact of a positive case outside of their home, they can still go to work or school. But how does this apply to sending kids to daycare or after-school programs?
And so we're asking that people avoid higher risk areas when they are not, when they're on that modified isolation, which would include daycare. But if you're talking about daycare workers, then, they have to have a discussion with their employer, and then they, depending on the situation, they would either be isolating and not attending work, or if they were deemed to be essential or critical for the maintenance of work, then they would have to make arrangements to be able to do that safely. But and that applies, that's the same as in any essential critical provision of service. But generally speaking, if you're in a higher risk category, which are outlined on the flow chart and on the website, then you don't go to work.
Thank you.
Peter Cowan with the CBC, do you have a final question?
I do. It's one for Dr. Fitzgerald or Minister Haggie, depending on who has the information at their fingertips. Today is the most number of deaths that this province has reported during the pandemic, and some of the figures that the minister gave us a second ago, that 60% of the deaths we've seen are people who are at least partially vaccinated. Does this raise any concerns for you about the efficacy of vaccines? And in a general sense, can you give us an idea of what sort of person we've seen who has died from COVID-19?
So no, it doesn't it doesn't influence how I feel about the efficacy of vaccines. We know that vaccines are still quite effective at preventing severe disease and death. We can't prevent all, and I don't. We've never made that claim. The vaccine has never made that claim. This vaccine is very good at preventing severe disease. It's and if you're boosted, it's even better. So we know those are facts. When we have such a highly vaccinated population, and if you look at where our deaths are in the age ranges, generally deaths are in older people. Those people over 70, for example, with 2 doses, you're almost 100% of that population is vaccinated. Over 98, 99% are vaccinated. Of course, you're going to see deaths in vaccinated people because that's pretty much all there is. So, this is not, once again, I caution people with looking at numbers without really diving a little bit deeper into them, because we are going to see deaths in people who are unvaccinated, and we're going to see deaths in people who are vaccinated. But what we know is that your risk is much higher of winding up in hospital if you are unvaccinated versus if you are vaccinated, and certainly versus if you are boosted. So the vaccine is still very effective at preventing that severe disease.
Renelle Legros with All Newfoundland Labrador, do you have a final question?
Yes, my question is for Minister Haggie. We have a number of hospitalizations now. I'm just wondering if you can give us an update on how things are going within our hospitals and the system. For example, are services slowly returning to normal now? Any concerns with staffing levels and so on?
Certainly, the staff in isolation piece has improved. We now have 759 healthcare RHA staff isolating currently. 561 of those are isolating because they are contacts or they're work isolating, and 198 of those are isolating because they are positive. Our bed occupancy is around the same level as last week, overall around 83%. We still have more people in hospital with COVID than because of COVID. We currently have 20 in with the effects purely of COVID. That's why they're there. And then we also have people who are in incidentally who have tested positive but are in for fractured hip or abdominal problems or whatever the case may be. So the total number of people in the hospital system currently is 80 who are COVID positive. We have never restricted access to cancer surgery or urgent surgeries. There is a steady flow of orthopedic emergencies in Central being dealt with on a timely basis. There is a steady flow of people who are given dates for surgery which are going ahead. It varies a little bit because what we've really tried to do, and the direction to the regional health authorities has been clear, is our priority is vaccination. What we want to do is to get our 5 to 11-year-olds boosted, vaccinated with their second dose. We're up to around 5% now with their second dose. They're just becoming eligible. Our group of concern at the moment, as Dr. Fitzgerald has highlighted, is that range between 50 and 69, whose uptake is lower than the 70 and over. They are still at risk. We have very few, if any, hospitalizations over the entire history of COVID of anybody under 50. So the key here is to get these people vaccinated. So there will be some delay in return to normal levels of service because the direction has been to the regional health authorities to get the children vaccinated, and if that means diverting staff to schools, for example, over the course of the coming weeks, that will happen, and also run mass vaccination clinics. So we're not back to normal yet.
Roger Bill with the Shoreline News. Do you have a final question today?
Yes, I do, for Premier Fury. Premier Fury, it's a follow-up question. Actually, it's something you said back in December at one of these briefings. It was at the time when the wave, the Omicron wave, was going to crash over us. It would become apparent. There were several unscheduled briefings, and Dr. Fitzgerald was introducing measures to kind of prepare for this. And you said at the time that you thought this Omicron wave could be, quote, a bit of a hiccup. If I had a follow-up, I would have asked you then about it, but I didn't. And so I'm kind of late in doing it now, but I want to invite you to clarify what you meant by a bit of a hiccup.
Well, I mean, obviously this has been more of a wave than anyone would have liked. And so I guess I would say then that I guess, I don't have a crystal ball back then, but looking at the evidence that was available then from Denmark and the UK, it certainly looked like it was going to be a milder variant. It has been a milder variant. Our hospital capacity hasn't been overwhelmed because of the measures taken. And, I wish I had a crystal ball, Roger.
Thank you.
Kyle Brookings of the CNA Journalism Program. Do you have a final question?
Yes, I do. My question is for Dr. When alert levels change, are we going to see a gradual reopening, or will we move back to alert level 2, for example?
Thanks, Kyle. No, it'll definitely be a gradual reopening. We have to do this, and as the Premier mentioned earlier, we have to do this very slowly and in increments, and gradually increasing the number of interactions that people are able to have. So, it's just opening the tap a little bit at a time to allow a little bit more water out so that we don't overflow the sink. And that's really the way that we have to do it. So we're watching things very closely, and certainly watching our hospitalizations and the rate of increase in our hospitalization, the rate of increasing in our cases that we know about. All of these things will be very important for us to help us determine, when we can move from one or ease restrictions a little bit at a time. So it's going to be a slow process, and it may not even be, alert 4 to alert 3. It may be some modifications within alert 4 before we move to alert 3. We just kind of have to look at things and see where we can make those changes to allow a little bit more functioning in society and not increasing our risk too much. So more to come, I guess.
Thank you.
Thank you, everyone. Premier, do you have any final comments you'd like to make today?
Yes, thank you all for joining. I think if you take nothing away from today, please take away that vaccines work. And the simple fact that Dr. Fitzgerald and I highlighted the same statistic from CDC, not our statistic, that unvaccinated seniors with COVID-19 were nearly 50 times more likely to be in hospitals than seniors with 3 jabs. That's all you need to know, that vaccines work. They're efficacious. They've done their job in preventing our hospitals from being overwhelmed. We are still looking at numbers daily, of course, but vaccines work. Please do your part to continue Newfoundland and Labrador's trajectory to continue to lead the country. It's something we should all be very proud of, and if you're considering getting your booster, please do so today. Thanks very much.
Thank you, Premier. Thank you, everyone, for joining us today. Please stay safe and enjoy the rest of your day.
The following program is brought to you by Rogers Anyplace